The First Day Forward initiative really grew out of the inmate interviews that we have done in, I guess at this point in 6 jails across northeastern Kentucky, where we sat down with individuals that had been arrested on drug-related charges, had a self-identified substance use disorder, and were willing to be interviewed about what had led them to their current situation, what programming was available to them in the jail, and what programming we could put together as a coalition upon their release. So that led us to do some brainstorming. We came up with the idea for a program, and one of Dr. McLean's colleagues, Wendy Fletcher, was actually the person who coined the phrase First Day Forward, that really targeting education to inmates while they're still incarcerated, but really focused on that first day of release. First Day Forward takes these peer support individuals from across our region, links them with those inmates, does a month to 3 months of engagement while they're still incarcerated, picks them up from the jail at the day of their release, gets them whatever necessities they might need at that point. During their incarceration, we've been working with them to make sure, where are you going upon release? Do you need any kind of treatment linkages upon the point of your release? What are you thinking in terms of employment? So we're working with them on all those types of activities to make sure that that they have a chance. I mean, that's all these individuals want and need, is a chance to get the right path toward recovery upon their release. So First Day Forward, we're currently providing that service in 3 counties within our region. We've had phenomenal success. Just recently, one of the first inmates that we engaged with had gotten released and had gone through the year of sobriety, and then went and got the training to become a peer support individual himself. So that is as big of a success story as you can possibly have. Somebody who was in jail, that we connected with them, and now they are doing what we want to have others in the region do: tell their story and be an inspiration to others.
The incarcerated population is considered very vulnerable and high risk from a addiction or MOUD standpoint. When they go into jail, if they've been utilizing or using illicit drugs, heroin, they have developed a tolerance to it. So their tolerance is very, very high. During incarceration, they go through the withdrawal. That tolerance is gone. They get out, they have a high risk of sudden death from overdose. That's the #1 cause of death within the first 2 to 4 weeks of release for inmates, because they don't understand the risk of going and using. In addition, now that we have the fentanyl on board and being laced in the heroin, that also increases the risk of death to these patients who were incarcerated and now released without any education or knowledge. And so part of hopefully the First Day Forward is some of that education regarding the tolerance to the heroin going in, and then the lack of tolerance coming out, and the increased risk.
Employment is so key to this. I mean, you can have various other things in place, but if these individuals upon release can't find a job, then the chance of them relapsing, being right back in that same situation, are much higher. So we've done a lot of programming within our region to try to put things into place to change the stigma that so many individuals unfortunately still have about individuals who even if it was in their past, there's still so much stigma about people that ever misused prescription medications or abused illicit drugs. So we're currently doing employment forums across the region, where we have peer support specialists that are doing presentations to employers across the region, telling their story about how they once were addicted, now they're in recovery, and that there are numerous other individuals like them across the region that can be very good employees for those employers across the region, and can really be a new source of employment and workforce development within the region.